The coronavirus pandemic put a damper on plans to ring in 2022 around the world. At the Vatican, attendance was limited as Pope Francis conducted his New Year's Day Mass. In an effort to discourage large crowds, the Pope also canceled his traditional New Year's Eve visit to the nativity scene in St. Peter's Square. In New York City, only about 15,000 people were allowed into Times Square Friday night to see the crystal ball drop. Before the pandemic, crowds there numbered over 1 million. And COVID continues to create problems for holiday travelers. More than 1,500 U.S. flights were canceled Friday as airlines report staffing shortages due to employees testing positive for the virus. Nationwide, new case numbers have nearly quadrupled since December 1st, when Omicron was first detected in the U.S. The CDC says more than 2 million coronavirus cases were reported just in the past week. That's already a record, but the numbers could actually be much higher because people testing positive with at-home tests aren't necessarily reporting their cases. For more, I'd like to bring in CBS News reporter Alexander Tin. Alex, I say Happy New Year, and I want to try to start with a hopeful question here. Omicron first emerged in South Africa, of course, and the early indications show that the rate of cases is declining significantly there. So do authorities think that we might see that in the U.S. soon?
Well, it's certainly possible, and with the caveat that this is not going to be too much of an upbeat answer for you. What we've heard from the CDC and from a variety of academic institutions, universities, and what have you, that have been working on modeling different scenarios of the variant's spread here in the United States is that, yes, it is certainly possible that some regions of the country that are currently seeing record high surges in cases of COVID-19, likely driven by the Omicron variant, could soon see a decline in the number of cases, potentially as soon as mid-January, if not earlier. But it's important to caveat that unlike South Africa, in the United States, there is a very diverse and heterogeneous spread of the Omicron variant. The prevalence is not the same in every part of the country. The number of new cases we're seeing in every part of the country is not the same either. There's Delta mixed in, and there's all kinds of other factors like mitigation measures and what have you that are likely affecting the way this variant is spreading in the country. And so to take a long answer and make it short, yes, we'll probably see a decline in some parts of the country, but we could also see new increases and new surges of the cases in other parts of the country over the coming months.
Alex, we mentioned that many people taking at-home tests are not reporting their results. Are those unreported cases a problem? And we know the president has ordered millions more of those test kits.
Yeah, well, to put it bluntly, it is a problem. I mean, we have heard since the beginning of the pandemic that anything we can do to improve the resolution of our tracking of the virus here in the United States, the way it's spreading, the number of cases you have in different communities, obviously would help public health officials and healthcare providers manage and track and predict and ultimately respond to the virus. But to be clear, this is also not a new problem. I mean, we've heard about this problem since the beginning of the pandemic. Even before the surge in the use of these home testing kits, we know that when you would do so-called seroprevalence studies, where you take blood samples that have been collected from people at commercial laboratories or blood banks, and you test the number of antibodies in those samples, you would see prevalence of the virus in some parts of the country that was far higher than was ever reported in COVID-19 test numbers. So again, this is not a new problem per se. It might be exacerbated by this home testing surge in interest we've seen ahead of the holidays. But at the same time, at the end of the day, what has been really the focus of public health officials is two things. The trend in cases, which is going up now in a lot of parts of the country, and obviously hospitalizations, which is a key metric not only of the severity of the disease, but the strain it is putting on an already strained hospital system that is facing staffing shortages, surges in other respiratory viruses, and obviously the day-to-day grind of accidents and what have you that also bring people to the emergency room. Those are going to be the key metrics that public health officials will be following in the months to come.
Alex, so many people thought 2021 would be the end of the pandemic, and we saw fits and starts of that return to normal throughout the year. But now we start yet another year with a new coronavirus wave. And I know you follow every detail on this and every little development. So in your judgment, how big of a setback is this, not just for us here in the U.S., but all around the world?
Yeah, I mean, putting aside, obviously the economic and the societal cost of another wave of the pandemic that we're all facing, there is a key way that is really worrying health officials. And that's the way in which a new wave of the virus brings two things. Number one, we know that the response to this new wave of the virus, both here in the United States and in other developed countries, has been an acceleration of the orders for booster shots. What that does is it deprives the stock of vaccine that was initially destined to go towards many of the countries that have yet to vaccinate large swaths of their population with the first two doses. That's also changed the number of supplies and the number of money and resources that you can devote towards those efforts. So that's a key setback in our global fights to curb the virus. But separate from that, there is obviously a larger concern, which is the way that Omicron spread. If you think about it, there was a real belief among many, not just virologists, but from public health officials that you would hear, that with the Delta variant being so dominant and so widespread, that any future variants of concern would likely descend from the Delta variant. Of course, what we know now is that the Omicron variant did not likely descend from the Delta variant. There are so many mutations, so many substitutions there that it really emerged as, some people like to joke, out of thin air, but more likely either from an immunocompromised host, potentially an animal reservoir that got infected and spilled back to humans. And the reason that's a concern is because of the way that this variant of concern emerged. The same pattern could repeat itself in the future and lead to future variants that we may not have the defenses and the therapeutics and the vaccines to respond to. So these two things are obviously major concerns and major setbacks. But at the end of the day, we know how to respond to the virus right now. And those are the things that health officials are pursuing.
The new year is always a natural time for reflection. So let me ask you, Alex, what lessons have we learned from the pandemic in 2021? And how do you think we can take advantage of those lessons when we move forward into this year?
Yeah, I mean, we've learned so much, right? I mean, some of the stuff that we've learned has been really interesting. It's the best ways not only to distribute vaccines, but also to track their safety and their efficacy. We've learned a lot more about the potential side effects that are linked to some of these vaccines that are largely safe and far more effective in many populations, especially once you get those booster shots that are now recommended for all adults in this country. But in addition to that, doctors have learned a lot more about how to respond to this virus, how to treat both patients before they get into the hospital as well as after they get into the hospital. You combine that with early signs that the Omicron variant severity might be a little bit lower, at least on the individual level, leading towards hospitalization and severe disease, as well as new drugs that are now coming onto the market, like from Pfizer and Merck, those antiviral pills that everyone is so excited about as potentially being game changers to how we respond to the virus. 2022 could be a much better year than 2021 because we know so much more now, not only on how to reduce severe disease, but also how to treat potential cases of severe disease, and ultimately and hopefully lead to a much less deadly, much less severe 2022 compared to 2021.
Alex, another thing on the horizon in 2022 is this discussion over the need possibly for an additional booster shot. And we know Israel approved a fourth vaccine regimen for its most vulnerable population, but some people are raising concerns over what they call over-vaccinating that might diminish the body's ability to generate immune responses. What can you tell us about that phenomenon?
Yeah, well, I'm not going to purport myself to be an immunologist or doctor here, but what I can tell you is what we've heard from some of the top vaccine advisors to the federal government, both here and in other countries around the world. We do know that it is theoretically possible to so-called exhaust the immune system. It's something that you often see with chronic infections of SARS-CoV-2 that last for many, many months. We also know that it's theoretically possible to get this kind of phenomenon if you give a booster shot, say, every day, right? But that's not what we're talking about here. The situation that we're talking about in Israel and that potentially could someday happen in the United States is the administration of a fourth total vaccine. So that's your first two doses, the booster shot, and then another booster shot after several months after you got that third shot. That's probably not going to lead to exhaustion. At least that's what we've heard from a lot of prominent immunologists here in the United States. But there are other concerns with the strategy. I mean, is it going to be more effective to boost with another strain? Is it even necessary to boost another time? Are you going to see that much of a difference? And obviously, those concerns are being weighed with also very real data we've seen emerging now, both from Israel and from the United Kingdom and other countries that have already rolled out booster shots, that it is possible that the efficacy of the vaccines, at least against infections, not severe disease, but infections, could be waning. That's definitely going to be a debate we're going to see once we come into this new year. But at the end of the day, to be clear, this phenomenon of exhaustion coming from a fourth dose, it's probably not going to happen. At least that's what we hear from experts, as long as you're not vaccinating somebody every day of the week.
Okay, Alexander Tin following all these different angles for us. Alex, thank you.
Thank you.